Hello, I think this would be a good time for all of us to get started. All of you that's here in Kirkland, I want to thank you. I want to thank you for joining us. And this is a holiday too, and you all came out, so it's really a special thank you. My name is Alicia Newbern. I am the program director for Northwest Parkinson's Foundation, and I'd like to welcome all of you to our Northwest Telehealth meeting this month. And I'd like to thank our host, which is Evergreen Healthcare. And I also would like to thank our sponsors, the Parkinson's Resource Center of Spokane, Albertsons, and the Northwest Parkinson's Foundation. All of the sites that are out there, I want to welcome you and thank you for being with us today. I want to let you know that after our presentation today, we're going to call on each one of you. And if you have any questions, just unmute your mic and then ask us the question, and Dr. Burdick will answer that question for you. Oh, by the way, who is Dr. Burdick? We have Dr. Daniel Burdick today. He is a movement disorder specialist at the Evergreen Booth Gardner Parkinson's Care Center, and he is going to be making our presentation today. I'd like to introduce you all to Dr. Daniel Burdick. Thank you.
Thank you, Ruth, Ruth and Alicia. And to Northwest Parkinson's Foundation for inviting me to give this talk today. There we go. So today, this month, is National Family Caregivers Month. And so in celebration and recognition of that, the NWPF asked me to speak about caregiver support and caregiver burden. So let me know if any of this rings true. These are some real stories. They're fake pictures, pictures I just found on the web, but real stories from my professional experience. First is a woman in her early 40s, still has a busy job, a household to run, all the pressures of kids and homework and mortgage payments, and her husband was just diagnosed with Parkinson's disease, wondering what that means for the future, has a lot of stress around that. Next scenario, a gentleman in his mid-60s who just retired and was looking forward to travel and seeing family during retirement. And his wife's doctor, me, just told him that his wife has Parkinson's and is wondering, what does that mean now? Stress in the early parts of Parkinson's. And in a different relationship, a daughter whose father has been living with Parkinson's for a number of years, living very well, having a very full life, but starting to have some more trouble with balance, memory. She's afraid that he can't live by himself anymore, is wondering about the next step and wondering how to go about that. So chances are that at least something in those scenarios rings true for everybody who's listening. Caregiving is a very common phenomenon in our society these days. In fact, in the state of Washington alone, the Department of Social and Health Services estimates that there are about 600,000 family caregivers for all manner of chronic diseases, but including Parkinson's. And so in recognition of the importance of this, November has been named, as I mentioned, the National Family Caregivers Month, to raise awareness and education and to have programs like this. So I think the first step is to understand what are some of the causes of caregiver burden. And I will say I'll be using a lot of terms interchangeably today. Caregiver burden, caregiver stress, caregiver strain, all basically equivalent. I should make special mention, though, that this is not the same as caregiving. The burden is maybe a product of the caregiving, along with many other features that we'll talk about. But of course, caregiving can be done in a very happy and satisfying fashion. But to talk about and understand the burden associated with caregiving, I wanted to highlight this survey from 2007, 5 years ago, that surveyed 80 people with Parkinson's, a majority of which were men, and their caregivers, the large majority of which were women, which is the very common scenario for caregiving. And through this survey, they found that the level of burden associated with caregiving was strongly correlated with some things you might expect. Of course, the hours per day devoted to care, the patient's age, the disease stage, the severity of the disease, the level of disability. In addition, and independently, if there's any presence of cognitive impairment, that is a strong predictor of the caregiver feeling some burden from the relationship. And independent of that, if there are any hallucinations, that also causes a great deal of strain to the caregiver. And then the presence of depression in the person with Parkinson's disease, another strong predictor. So those are the features of the disease, of the patient. There are some important features in the caregiver, him or herself, that can be correlated with a high degree of burden. Number one is gender. Women are more susceptible to feeling caregiver burden than men, for whatever reason. But this is significant because, as I mentioned, the large majority of the caregivers are, in fact, women. But the most significant feature is the presence of anxiety and or depression in the caregiver. And in fact, it led these researchers to conclude that the caregiver's emotional state is the most important feature that influences the caregiver's perception of burden, as well as the perception of their own physical health. So, and importantly, this survey also found that the caregiver burden was not associated with the caregiver's age. So you could be a young child of a person with Parkinson's, or an older spouse, or even parent in some cases, and that does not predict level of burden. As well, the disease duration does not predict level of caregiver burden. Of course, those with longer duration are more likely to have more severe disease, but not necessarily. And many people can go for many years without progressing too fast. And in those cases, the caregiver burden would be proportionately less. Now, this table is from a different survey, slightly smaller one, but an interesting one nonetheless. And what I find interesting about it, these researchers asked, I think it was 36 or so patients, caregivers, to rate the tasks that they found most burdensome. And what I find interesting about this is that the ones that were mentioned most often, the ones at the top of the list, are really quite mundane tasks. Things like providing transportation to doctor's appointments, but also just into other general outings. Next was housekeeping, house cleaning. Grocery shopping made the list. And it really isn't until you get down here to supervision or administering medications that you get into Parkinson's specific issues. And I'll come back to that point, but I think it's an important point to remember. Now, this set of conclusions actually comes from yet another survey, and this was actually more of a series of case interviews by psychologists interviewing caregivers. And they drew some general themes out of their interviews. They concluded that, in fact, mental tasks, the decision-making, the medication management, financial decisions, they found that those are more burdensome than some of the physical tasks. So that is a little bit in contrast to what we just saw. But I think possibly even more important is safety concerns. They found there was a very common theme among caregivers that they interviewed, just a sort of general constant state of anxiety that their loved one, the person with Parkinson's, would injure themselves. And of course, a big factor in that is the presence of gait instability, difficulty walking. Not only does that produce a general anxiety in the caregiver, it produces something of a conflict in the relationship, since the solution to anxiety is often to provide gentle reminders, some cases maybe not so gentle. And so it's both the anxiety about the fear of injury to the partner, as well as some relationship strain that can cause safety concerns to be a big predictor of caregiver burden. And then, in addition, they found social isolation to be a common theme frequently mentioned among people they surveyed. And of course, everybody I'm sure is aware of how social isolation can come out of Parkinson's disease. Just as a couple of examples, symptoms in Parkinson's are often unpredictable. You could be feeling good 1 hour and bad literally the very next hour, and that makes it very difficult to plan an outing, to plan something with friends. And the Parkinson's often has a very complex medication schedule, much more so than other chronic diseases. And if you're worried about taking 2 pills at 9 and 1.5 pills at 11 and then 3 pills at 2 p.m., it can be very difficult to plan anything else, much less a social outing. And then I want to introduce a term, mutuality. Mutuality, often used to refer to marital relationships, but doesn't have to be, it could be any relationship, refers to essentially the equality of partners in a relationship, the quality of their interaction. So, for instance, the degree to which feelings are shared, how many feelings are in common, and then how many activities are shared in common, pleasurable activities. And again, easy to see how Parkinson's can reduce mutuality, reduce the sharing of feelings, reduce the shared feelings, reduce the shared activities. Parkinson's makes communication very difficult, both for verbal and nonverbal reasons. Speech can be difficult. There can be some difficulty cognitively coming up with the right words. And then nonverbally, of course, we rely a lot on facial expression to communicate our thoughts and feelings, and Parkinson's can take that away from us. Parkinson's, of course, can also limit shared activities, particularly if you were very active, physically active together before Parkinson's. I certainly know many people who continue to be very active after Parkinson's, but undoubtedly it limits that to some degree. And then a sense of dependency, either physical or cognitive. Dependency reduces mutuality. It reduces that equality in a relationship. And interestingly, in 2008, going back a little bit to what they found in the last survey, in 2008, they found that of all Parkinson's symptoms, it was gait impairment that had the biggest effect on mutuality. So people who had difficulty walking, difficulty with balance, risk of falls, that actually had the greatest effect on lowering mutuality. Yeah, I think somebody's mic is on, so hopefully we've turned it off now. All right. So bottom line, though, is that lower mutuality is strongly associated. So, of course, big question is what can we do to improve this situation? And as an answer, I have a brilliant mnemonic, a brilliant memory device. I came up with it myself. I'm very proud of it. EARS. EARS. So EARS stands for Education, Assistance, Resources, and Self-Care. So the rest of the talk, I'll go through each of these, explaining what I mean, and certainly welcome your feedback on the thoughts. So to start with education. Of course, you're all listening because you presumably already believe that a little education can alleviate a lot of anxiety. Getting educated about a topic can help you understand what there is to understand about it, and just that in itself can help quite a bit. But the things to learn relative to this, of course, caregiver burden, learn about it, and understand what can contribute to it, as I just went through. But do your own reading, get a little bit more well-versed in it. And then, more importantly, take that knowledge and apply it to your own situation. Understand the sources of stress in your own caregiving role, in your own caregiving relationship. And I will say a lot of times the analysis of your situation can just by itself, even if you're not able to come up with solutions per se, can lower levels of stress because it turns on that so-called thinking part of the brain, the prefrontal cortex, that can override some of the pure emotional parts of the brain. So that can help. And then additionally, of course, you want to be aware of and understand what to look for in yourself and recognize signs of stress in yourself. Things like irritability, anger, guilt, weight loss, and depression. And I just put up there one site as a good screening tool for depression. There are many out there. And of course, if you have any questions about depression, best to talk to your own provider. Secondly, of course, you want to learn about Parkinson's in general. I'm sure many people out there are experts at Parkinson's, probably even more than I am at this point. But always helps to learn about the disease itself. Of course, there's everybody has their own approach, whether they want to know a lot about the future of Parkinson's or not very much about the future. But either way, I think it's fine if you want to learn a lot about the future, or if you want to just sort of stay in the present day and just focus on today. Either approach is fine, but I do think it's helpful to understand current symptoms and possible symptoms that might creep up in the current stage of Parkinson's. That really helps you know what to look for, what to tell your provider. Next, of course, make sure you understand the medications. And one point, of course, is to understand what the medications are that you're being currently prescribed, how to take them. As I mentioned, it's a very complex regimen in many cases. And so being very clear and getting something written down at the end of a provider visit can be very useful to make sure you know how you're supposed to take the medications. But I think probably, well, at least as important, is to understand the expected benefits of the medications. They're not a cure-all, so it's important to understand what symptoms will get better with the treatment and what symptoms might not. What is it that we have to learn to live with or find workarounds to improve? And then, of course, understand possible side effects. Now, I'll say that medications are often blamed for every sniff, cough, etc. In some cases, it's true, but I think it's important to know the side effects that might be a product of the medications you're taking, and to look for those. And it's important because, of course, the medications we use for Parkinson's, some of them have very real, very dangerous side effects. And all of that really leads into the concept of learning how to be an advocate for your partner in Parkinson's. Knowing what to look for, when to tell a provider. Now, just as a specific concrete example of that, return to this slide that I showed you earlier, with an emphasis on the hallucinations and depression as being strongly associated with caregiver strain. So if you understand that, if you understand that hallucinations and depression can be a part of Parkinson's, and you learn how to recognize the signs of those, you can play a very important role in letting your provider know about that, because these are symptoms that may not be eliminated, but can definitely be improved with appropriate treatment, and thereby improving both the person who has Parkinson's, improving their experience, as well as improving your own caregiving experience. Also under education, I put physical and occupational therapy. Now, of course, PT, OT are specific treatments that do indeed improve symptoms, but I think an important role of PT, OT is to help you learn, you and the person with Parkinson's, learn ways to cope with the physical difficulties and learn those workarounds that can make your life better, even if we can't improve some of the symptoms. I think additionally, it's helpful in relieving some of the anxiety about safety. Again, not that we can eliminate the safety risk entirely, but at least it can help you feel like we're doing everything possible, that you're doing everything possible to help your partner in Parkinson's. And then PT, OT can indeed, as I said, improve the activities of daily living, improve ways of getting around the day, and lessen the sense of dependency, which again can improve the caregiving relationship. And then in a similar vein, psychotherapy, psychological counseling, again, it's a specific treatment that is designed to improve symptoms. But one of the ways it does that, and one of the important things to take away from it, is learning how to cope with the emotional burden that can be caused by Parkinson's disease or by caregiving for Parkinson's disease. So that's education. assistance, sort of self-explanatory, assistance can help by reducing the hours per day that you need to devote to care. And again, so this is, I'll return to this chart and point out that assistance can help a lot with things like providing transportation. Depending on how close you are, I guess, to the person, they might help with some of the housework. Maybe grocery shopping. Next time you go to the store, hey, can you pick up a loaf of bread for me? So on this list of burdensome tasks, friends, acquaintances can really help out a lot without having to get into the nitty-gritty of Parkinson's, without having to become experts in Parkinson's. Bottom line is try to build a team. Get together a team of assistants to help with things along those lines. Can come from friends, family. And then I put up independence because a lot of times when I suggest this, people will say, oh, I want to remain independent. I don't want help. I want to do it all on my own. But in my experience, and this is just sort of anecdotal evidence from my practice, I think the people who know how to ask for help, know whom to ask for help, and know when to ask for help are the ones who really are the most effective at, in fact, staying independent. They are more, feel more assured staying at home. They don't feel the need to go into any long-term care as soon. And then, of course, a lot of our social relationships are built on mutual help. And so asking people for help, and when you have a chance, maybe returning the favor, can really help strengthen that social network and thereby combat the social isolation that was cited as a cause of caregiver strain. So under assistance, there is the option, of course, of professional assistance for those who have the means. At least in the Seattle area, rough estimate is $25 an hour for an independent personal professional caregiver. Presumably that is not within the means of most people. One other option is looking into respite care. Many assisted living facilities or skilled nursing facilities do offer short-term stays to provide some relief for caregivers. And again, not the cheapest, but it is more affordable than a personal caregiver. And that's an estimate of, again, not really market data, just sort of a broad estimate of what assisted living facilities charge for the service. Skilled nursing facilities would be more if the services needed are more. And then just for those in the Puget Sound area, I don't know how many of those actually are listening, but the Evergreen Care Network can help make referrals to those situations. I'm sure for those in other areas, starting at least with your local provider can be helpful in finding a facility that might offer this. That's assistance. Resources. The plug I'll make here is find your resources early. It's much easier to look for good resources when you feel you don't need them, and to have sort of a Rolodex of sources when you do get to the point of needing them. Much harder to be in a crisis situation, feel that you're a desperate need of help, and not have anyone to call. So presumably most of you are already in a support group. I assume that's how you've all signed into this program. But support groups are a fantastic way to reduce social isolation, improve mental, psychological, emotional burden, and of course they're a very good source of education as well. I presume you're also all familiar with the Northwest Parkinsons Foundation, but perhaps you have not explored their website as fully as you might. They have a very good website at nwpf.org. They have an incredibly comprehensive list of support groups, including, I'll mention, support groups specifically for caregivers. There aren't as many of those as there are for people with Parkinson's, but they do exist, and I think do serve a vital role in caregiver support. And then additionally at their website, they have an excellent wellness center, which is a really good educational resource. Lots of information about almost every symptom you could think of with Parkinson's disease. So a good resource if you want to look for it. And then last I'll mention, they have published a pamphlet along this topic, Who Takes Care of the Caregiver, subtitled 16 Helpful Ideas on How to Help the Parkinson's Person and Still Take Care of Yourself. It's written by a gentleman named Hal Newsom, who himself has Parkinson's, wrote the book called Hope about his own experiences with Parkinson's. And this he wrote with his wife, Peggy, offering some simple tips. It's concise, well-written, pretty easy and good read, I think very helpful. So I presume they can get that through the website, nwpf.org. In addition, there is the Washington State Chapter of the American Parkinson Disease Association. They have a website at waparkinsons.org. Again, they have a list of support groups, and they also offer the Information and Referral Center, an excellent resource for information and referrals. So, and though it is called the Washington State Chapter, they make this Information and Referral Center available to people in Oregon, Alaska, even Hawaii, and parts of Idaho. And for those of you in Montana, they have an Information and Referral Center, the APDA does, in Great Falls. And that's the phone number if any of you are interested. For those in Washington State, the APDA also offers their taxi voucher program, which can help with the burden of transportation. I think there are some restrictions on that, so if you're interested, give them a call or go to their website. And then, especially helpful, although unfortunately at this point only available in Western Washington, is the Caregivers Day Off, which allows 20 hours per year of professional caregiving support. Again, there are income eligibility requirements for that. So if you're interested and in this area, contact the APDA. And then in addition to the independent nonprofit organizations, of course, state governments provide a great deal of social services. Here in Washington, the Department of Social and Health Services, I want to highlight the T-Care system. I'll go into more detail on that in a little bit, but just wanted to draw your attention to that term. And then you can find your state and look up the website there for the Department of Health Social Services. Now, for those of you in rural areas specifically, there are a number of associations, organizations that try to extend the services to you that might be harder to find than for those in urban areas. Number one, through the Cooperative Extension System, in connection with the land-grant universities, they have a good family caregiving website. The Federal Department of Health and Human Services has a Rural Assistance Center at that website. And then the independent National Rural Health Association offers the Rural Health Web at ruralhealthweb.org. So I mentioned T-Care. I want to explain this a little bit more because this is a system that I find interesting because it was specifically designed to try to improve the caregiving support that's available. It stands for the Tailored Caregiver Assessment and Referral. Was developed primarily at the University of Wisconsin, but also developed in part at the Washington State Department of Social and Health Services. And the basic idea is that the most effective caregiver support is that which includes multiple services, and it's most effective when it's targeted to an individual's specific needs. So the T-Care system is a formal protocol designed to analyze an individual situation and make specific tailored recommendations. And this system was formally studied, published just last year. They studied 266 caregivers in those 4 states, including here in Washington, who said they either probably or definitely planned to have their family member with chronic disease. This wasn't not just Parkinson's, but included Parkinson's. Planned to place them in long-term care, or the caregivers reported high levels of caregiver burden or high levels of depression. These caregivers, essentially they were brought into the study only after they called the state or local social services agency and said, we need help. They responded, well, would you like to participate in this study? And for those who said yes, they were randomly assigned, so basically by coin toss, randomly assigned to either getting this new T-care system or to get the traditional services that they would have gotten anyway. So nobody was left out in the cold. And here are some of the results. Pretty telling, I think. This is a chart of depression symptoms. The solid line shows depressive symptoms for those who participated in the T-care system. And then the dotted line shows symptoms for those who got the traditional services. And of course, down is better. So you can see the T-care system really did more significantly improve the depression than did the traditional services, which actually went up a little bit, although I don't think it was a significant difference from beginning to end. So in addition to depression, they looked at a number of other factors in caregiver burden, and the T-care system improved most of them, including so depression, including and then relationship burden, so the strain of the relationship and the burden that caused. The kind of overall stress burden was also reduced with this system relative to the traditional system. And it reduced the intention to have the loved one go into a long-term care situation. And then it also reduced what's called identity discrepancy. I'll just introduce that term now, but I'll explain that in a few more slides. So T-care improved all those. The traditional support that's provided by those agencies actually saw increases in those areas. Again, slight, but they certainly didn't get better. So that leads us into self-care. And again, I think this one is pretty important and goes to this point that I made earlier, that that caregiver burden is especially predicted by caregiver anxiety and depression. And we already saw it's an important factor in influencing caregiver burden. So this one's sort of self-evident, but be attuned to your own emotional health. Recognize signs and symptoms of strain and stress. And if it becomes pervasive, don't hesitate to get help. Set aside time for yourself, leisurely bath, or whatever it is you like to do. I think also a really important one, and this is not a selfish act. A lot of people are concerned about that, but truth be told, you can really only help others when you feel complete yourself. And so in the context of providing an extensive amount of caregiving, it's appropriate and important to set aside a little bit of time for yourself. And then the importance of social contacts, make that point again. And then I also want to put in a plug for maintaining I said spousal relationship. It can be any relationship, really, whatever the relationship is from care receiver to caregiver. And this is where I'll explain that caregiver discrepancy. So there's a theory that a lot of the caregiver stress actually arises from a discrepancy, a disconnect between a caregiver's self-perceived identity, whether it be a spouse or child, and the actual caregiving responsibilities that they're assuming. So in other words, we all have an idea about what our role is in a relationship and what that role means, what it means that we're supposed to do. But when one of us develops a chronic disease, the caregiving responsibilities start to accumulate, and those are outside of our typical role. And that disconnect is the source of a lot of psychological stress. So to that end, the recommendation is to set aside a little bit of time specifically for the relationship. Again, whether it's a spouse, whether it's a father's son, you used to enjoy going to ball games, do that. Just go on a date night if you're married, or even if you're not married. And obviously, in some situations, this will be more difficult than others. But I think do what you can do, even if it's just sitting at home and talking about something completely other than Parkinson's disease. And the importance of that is that it will improve mutuality. So this is the slide I showed you earlier as well. Mutuality, low mutuality, strongly associated with caregiver strain, and having that connection is very important. And that leads me to the final reason that I like to use this mnemonic EARS. Not only does it stand for education, assistance, resources, and self-care, I use it to remind ourselves to listen. Listening builds the relationship, builds the connection, improves mutuality, and thereby reduces caregiver strain. And that's really the best way to become the partners in Parkinson's. That was the best way to get down this bumpy road. So those are my thoughts. I'm happy to hear others.
Good thoughts.
Thank you.
Do you mind if I add a resource?
Yeah, please.
Are we on?
Yeah.
Is this on?
That is on, yes. I hope so. I've been talking for 40 minutes.
Can everybody hear me? People hear me? Shake your heads. Okay.
Shaking.
I'm Ruth Egger. I'm with the Northwest Parkinson's Foundation. I'm the social service manager. And I want to thank you very much for that wonderful presentation. I want to add one resource that I'd like you to consider. One of the slides that Dr. Burdick gave you was all the area agency on aging in each of the states. Every state has an office on aging, and each state has a family caregiver program. And in Washington State, you can get respite care like almost 5 hours a week if you score high enough on the T-Care. The T-Care assessment assesses the caregiver's burden and this caregiver stress. If you are looking for a respite and looking for some help, you can call your office on aging in your county and ask for the family caregiver program. And I don't know if we can go back to that slide that had all of those websites. Yeah, that one, right. And so these are all the websites of the state offices. In addition, there is a program called Powerful Tools for Caregiving, and that's a 6-week class that a lot of these offices, these aging offices offer, and it's a fabulous program to help caregivers learn how to take care of yourself. So it's called Powerful Tools for Caregiving. You took it? Okay. So now what we're going to do is go through each site, and you'll have a chance to tell us how many people are at your site and also ask any questions. So we're going to start with Anchorage. And so Anchorage, if you can unmute your microphone.
Yes, there are 6 of us here.
Excuse me?
There are 6 of us here. There are 6 of us here. And I do have one question.
Okay, you have to speak a little louder because we can't hear you that well.
I have one question. My question is, what can a caregiver do to make life better for the caregiver?
Sorry, I didn't.
Can you speak right into the microphone?
That's right, yeah. What can a caregiver do to make life easier for caregivers?
Oh, okay, that's a good question.
What can a care receiver?
A care receiver do to?
What can a care receiver do to make life easier for the caregiver? Well, I think there are probably people in this room that could answer it better than me. But that was part of what I was going to with the idea of mutuality. That really is a two-way street. So much of the focus in Parkinson's is on the person with Parkinson's, rightly so. But I think it's important for each person in the relationship to remember the importance of listening to each other's feelings. And I think that could go a long way as much as anything else.
Is there any
comments.
training, or does that come in?
Oh, wait, you
in
can't-
conversation?
I don't know if you can ask, they can't hear your question, so
So we had
just hold it.
we had a follow-up question about specific training for the person with Parkinson's to make it easier for the caregiver. And I don't know of such a program. I don't know if you do.
I don't.
Yeah.
That's a good
There you go.
idea.
But there you go. We'll start one.
Thank you.
Yeah, otherwise, I think honestly, I think almost everything I said today could equally apply to the person with Parkinson's. Being a partner in understanding the disease, understanding the medications, the side effects, expected benefits, going to PT, OT, doing the best to practice those exercises, and just follow through on the care plan.
Any other questions, Alaska? Anchorage, any other questions?
No, we have no other questions. Thank you very much for the great
Okay.
presentation.
Billings, Montana, can you unmute yourself? Okay, great. Clarkston? Clarkston,
Good afternoon,
Washington?
Ruth. Good afternoon, Ruth. We have 13 people attending. Don't have any questions today, thanks.
Okay, well, you got snow over there today?
Just in the air.
All right, stay warm. How about Coeur d'Alene? Are you there, Coeur d'Alene?
Yes,
And how many you got?
we had 10.
And any questions from you?
Did anybody have any questions? No, no questions.
Okay, thank you. Colfax?
We don't have Colfax on today.
Oh, okay, thank you. Colville?
We have 4, and we all enjoyed the program and no questions. Thank you.
Okay. Dayton?
And we do not have Dayton connected.
Who's telling me that? Is that
Northwest
Spokane?
Telehealth.
Okay, thanks. How about Grangeville, Idaho?
And they just hung up.
Okay. Kennewick? Miles City? Moses Lake? How about Omak?
Moses Lake,
Oh, Moses Lake?
there's only one of us here, and
Okay.
I don't have any questions, thank you.
Okay. How about Newport? No? Omak? Omak? Othello? Okay. Port Townsend? Where are you all today? Having the holiday. Pullman?
There's one here, and probably the reason people are not there is because of the snow we've had. I had to scrape 3 inches off the car to get here.
Oh, my goodness.
No,
All right. Well, be safe. How about Ritzville? Tenasket? Walla Walla? Wow.
Yes, I have a
Spokane?
question.
Spokane, are you there? No?
Walla Walla has a question.
Oh, Walla Walla has a question. Okay.
We're wondering
Go
if you
ahead,
have
Walla
some...
Walla.
Pardon?
You can talk. Please give us your question.
If you have someone who is old enough for Medicare, what are the steps they take to go from there to getting an assistant and to getting involved in one of these programs to help at home?
So the question is, does Medicare cover in-home assistance? Is that correct?
Yes. And what
That-
steps do they take to find out?
Well, to my knowledge, I don't know that they cover it.
No, Medicare will only cover assistance if you need skilled care in the home. But if you're on Medicaid, you could be eligible for the COPES program. And if you're just over the Medicaid or SSI level, you might be eligible for the COPES program with a share of cost.
What steps do they take to find out?
Excuse me?
What steps do they take to find out?
Okay, so you, in Walla Walla, what county are you in?
What township? We're in Walla Walla County.
What county? What county are you in?
Walla Walla.
Walla Walla County. So my suggestion would be to call your local county aging office or your senior center and tell them you'd like to talk to somebody about getting in-home assistance.
Okay.
And then someone will come out and do an assessment and see if you're income eligible. You have to be at a certain income to qualify. But if you're just above it, sometimes it's worth it to go with the same program and have a share of cost. It depends on your income. Unfortunately, the income is quite low, but you can have enough savings if you have a spouse also. So if you have a spouse and you have a lot, like $50,000 in the bank, you still might qualify for this COPES program. And then you can also call me at Northwest Parkinson's Foundation, and I can help you walk through it as well.
Thank you.
Okay.
Spokane's here now, and we have 17. We have 17 in attendance, and we have no questions. And thank you, Dr. Burdick. That was a good presentation.
Didn't ask how many
Okay.
are here.
And now Kirkland, do you have any questions here? We have 5 people.
Well, I hope that.
She tried to give you a place to start.
The mutuality, I
Like
feel
the Senior
it's
Citizen Center.
because the patient assumes a lot of responsibility. That really helps the caregiver. And my question is, what are you doing to encourage the responsibility of the patient?
What
For
are
follow
we
through
doing?
on all the things that you want the caregiver to do?
Right. Well, I think.
Do you want to repeat the question?
Sure. So the question is, what are we doing to ensure that the patient follows through on all the things the caregivers are supposed to do? Well, I think everything I said today, the focus of the talk today was, of course, on the caregivers, but everything today that I said really could be applied to the person with Parkinson's. And I think that's probably more often the case, that we're telling, maybe not, I suppose it depends on your personal situation, but I think often we're speaking to the person with Parkinson's, and the caregiver is sort of on the side almost, that the caregiver's personal needs are not really addressed in the visit. So I think that was really the focus of the talk and of the month. But yeah, I don't know if I have a better answer than.
One thing you can do is for the person with Parkinson's should try to continue to do the same things that person has always done, and physically and emotionally, until they're not able to do them anymore, and then maybe do it in a modified version. So like if the person with Parkinson's always made the bed, that person should continue to try to make the bed and continue those tasks. So lots of times someone with a physical disability might say, oh, you know, I'm in the care receiver situation, and they start lessening the things that they'll do at home because they're in that position of seeing themselves as a care receiver, and that someone else, like someone, they'll say, oh, can you get up and get me a glass of water, when that person is totally capable of getting up and getting a glass of water. So you have to try to keep reminding yourself, the person with Parkinson's, that you still can do the things you need to do, and that you're always done before, so that you stay independent and that you don't put a burden on the caregiver. So, did you have a question?
Yeah, a little bit more explanation on T-care. Is that dependent on income as well?
No, that's, anybody can call the DSHS and ask for caregiver support, and they'll take you through the T-care system. It's just what they sort of, as I understand it, that's what they automatically apply.
Right.
It's the system they employ now.
They start out with a phone assessment, and then they'll do the next step, and then the next step, and depending on where you rate on the T-care will depend on how much services you'll get. And if you're in a situation now where you don't really need too much help, it's still good to get registered with the Family Caregiver Program. So in case down the road in 5-10 years you do need help, you're already in the system and you've already,
It is separate from just the one.
it's the same thing.
Oh, it is the same?
Yeah, but this is the state website. You can call if you live around here, you can call Evergreen Care Center and they will do it.
Sounded like T-Care and that were two different.
No. So T-Care it's just a system, a protocol that social service agencies can use. And they were comparing in that study, they were comparing the T-Care system to the kind of traditional system. And that's what that study would conclude, yes. It's more effective.
Okay, are there any other sites that we missed? Are there any other questions that anyone might want to ask from around the sites? Okay. So again, I want to thank Dr. Burdick and all of you and all of our sponsors for coming today, all the volunteers that help with this, and Evergreen Care Center and Parkinson's Resource Center of Spokane. Next month, we have a program on DBS, deep brain stimulation, and it'll be broadcast from Spokane. And anybody in Spokane want to tell us who the speakers are? I know it's Jamie Marks and one other person. I don't know if Cindy is there. Well, and then next week on Saturday the 17th is the annual HOPE conference here in Seattle area. Hope that some of you will attend that. And I want to thank everybody for coming, and we'll see you next week. Oh, great.
Ruth,
Yes,
real
Cindy.
quick. Sorry,
Yeah.
this is Cindy.
It's okay.
It will be, as you said, Jamie Mark, who is one of the top DBS technicians in the country, and Dr. Carlson, who's one of the surgeons who does DBS.
Great.